Good morning, good afternoon, good evening. This morning I have the pleasure of speaking with Dr. Julie Hoffman. Dr. Julie is a certified yoga instructor who's also completing her 500-hour teacher training this year. And I have personally taken her classes, and I can tell you that she's a genuinely authentic yoga teacher. Dr. Julie's career started as a labor and delivery nurse back in 1992. And after completing her BSN at the University of Arizona, while she was an RN staff, she also completed her MBA from University of Arizona. She attended her DNP in 2012. And in her own words, her career has taken her from bedside to the C-suite, from labor and delivery to hospice, and from inpatient to outpatient. But she also teaches prenatal yoga and chair yoga and yoga for stroke survivors and anyone who's recovering from injury and surgery. So thank you for joining us, Dr. Julie. Would you want me to call you Julie or Dr. Julie, or what would you prefer?
Julie is perfect. Thank you so much. Thank you for the kind introduction.
Absolutely. So I'm really interested to speak with you today about your class for yoga for stroke survivors. And I want you to tell me in your own words, what got you interested in this class to begin with?
Thank you. So my sister, I have a younger sister, 6 years younger than I am, and she's actually had several strokes. And as I've worked with her and offered to help her with yoga, I've noticed the difference it has made in her life, how she's been able to regain some mobility and also how she's been able to relax. Of course, yoga is not only good for our bodies, yoga helps our minds. And as I saw this happening with her, then I began to expand and started working with other folks who had also survived strokes.
Great. So what would you say is the difference between this class and taking any other yoga classes?
So hopefully anytime someone goes into a yoga class, the teacher is teaching to the students that are there. Mm-hmm. When I have students who have survived a stroke or who also, as you noted, maybe a student's had a brain injury and they come to this class. So I'm checking with them at the beginning of class to know, do you have weakness on one side of the body? Some of my students have aphasia and they cannot speak. Mm-hmm. Some of my students may be weak on both sides of the body. With this particular type of yoga also, I always start in the chair. So we're going to do, and that may be the entire class that we are working in the chair. And I'm going to offer some alternative variations to poses to accommodate the fact that maybe these clients have no movement on one side of their body.
Mm-hmm. Fantastic. So you would say that this is basically, it can be modified for any type of brain injury, brain surgery. It doesn't necessarily have to be a stroke.
Yes, exactly. Okay. And this actually came to me when I was talking to a group of people who all had aphasia and realizing that many of them have suffered a brain injury, that although it wasn't a stroke, they have some symptoms that I'm seeing in my patients, my students who have a stroke, who have had a stroke, and that they can't move one side of their body potentially. And of course, the ability to communicate, to not be able to speak the words. These folks with aphasia, their words are in their head and they can text me, they can put in the chat, but getting the words to come out of the mouth is the challenge there. So that's also something we're making sure when we're doing a yoga class is, do you have a way to communicate with me? Because in a regular class, someone might just shout out, hey, I don't understand what you're doing. Here we make it clear. You can put a message in the chat, or they could also send me a text during the class. Because of course, right now we're doing everything online. If I do it in person, I can actually have someone texting me on their phone when I'm sitting right there with them. That can be a very effective way to communicate.
Okay, that's a great approach. I love that. So let's say if I decide to join the class today, what should be my expectation as far as the class, as far as being prepared for it? What should I be expecting?
So I'm going to ask you to have a chair and make sure it's a sturdy chair. We want to be on a surface that doesn't move. So we're setting up just like a regular chair yoga class. And then from there, at the beginning of class, I would be asking you, perhaps I'll ask you before, but for sure I'll ask during class if you have any weakness side to side so I can accommodate that. And maybe I have a class where that's established, and for everyone in the class, 4 people, they all are weak on the left side of their body. And then you come in and you have a weakness on the right side. Well, I want to make sure I'm accomplishing that and calling that out for you. I don't want to be teaching to the group that can move their right side, and then I have a new student who has weakness on his or her right side. So I'm doing that just quick, just asking folks to tell me where their weaknesses are, if any. Sometimes folks don't have any weakness. But we are going to start in the chair. We are going to move at a pace that is slow, that allows us to hear and understand what I'm saying. And again, I'm going to make sure you know how you can communicate with me during the class.
Okay, thank you so much. That really clarifies a lot. I'm sure if anyone has had any sort of injury or surgery or any kind of difficulties, it's always a little bit scary. Maybe there might be some hesitancy about joining a yoga class, and it's nice to know that you're in safe hands when they take your class, and it's a secure space, and you just have a tendency to create that anyway. So I'm sure you're even that much more, uh, kind and careful when you're teaching this particular class. So tell us a little bit about where you teach right now, and any other talks that maybe you like to share with us that you do generally online.
Sure. So for the Yoga for Stroke Survivors, and again, just as you've said a few times, that could be someone who's also had a brain injury, someone who's had some type of surgery that has made them weak side to side, someone who's in a recovery. We have an online class. It's with startwithyou.yoga. And that's just like it sounds, the 3 words, start with you and then .yoga. And you can sign up for the Yoga for Stroke Survivors on that website. That is Wednesdays. I am in Arizona time. We don't do daylight savings. So sometimes we're Pacific time, sometimes we're Mountain. It is at 10:30 in the morning, Arizona time. And I know we're getting close to where that's going to change. We're currently Pacific time. We'll change to Mountain time, I believe, November 1st. I think on Halloween we switch. That is one place to find me. Certainly, I also, if you are local, I can go into your home and work with you directly. You can see my name is up here on the screen, Julie Hoffman. I am Julie Hoffman Wellness. You could also reach me through Start With You if you wanted to reach out that way.
Okay.
And I think that's it. I thank you so much. I'm always working to get this word out to people. This became a personal passion when I had my sister. She's actually had 3 strokes. And you see what happens to the individual and what happens to the family. So it's something I'm really wanting to make sure people are aware of, that this is an option to be able to do yoga after you've had a stroke. And I thank you so much for taking the time to interview me today so we can get the word out.
Yes, definitely. Thank you so much. I personally think this is very important work, and definitely wanted to share it with as many people as possible.
Thank you.
Thank you. Have a good day.
You too. Bye-bye.
Bye-bye.